Say a few words. Say a few words about, I guess I need to hit, got it. Say a few words about Child Abuse Prevention Month, which is about ensuring the safety, health, and well-being of both of our counties' families every day of the year. And it requires an ongoing commitment of our community to make sure that there is support for children and families when and where they need it. And I know that's why you're all here. And in Marin and Sonoma counties, we're really blessed, excuse me, that we have a community that has a large range of caring people and community agencies and government agencies who are dedicated to supporting both counties, children and families. And we're even more fortunate that all of you have chosen to join us today. So thank you so much as we work to spread the word about child abuse prevention and promote the development of trauma-informed practices that support and heal our children and families. In the spring of 1989, a grandmother for Virginia began the Blue Ribbon Campaign as a tribute to her grandson, her 3-year-old grandson who died at the hands of his mother's boyfriend. And when that grandmother tied a blue ribbon around the antenna of her car, she was asked the question, why did you tie a blue ribbon? Why'd you use the color blue? This is what she said. I intend to never forget the battered, bruised bodies of my grandchildren. Blue serves as a constant reminder to me to fight for our children. And since that time, concerned citizens all over the country have worn a blue ribbon as a symbol of the need to prevent child abuse and neglect, which you probably can't see mine, but it's here. Locally, our child abuse councils in both Sonoma and Marin counties work vigorously to bring awareness around child abuse in our communities. And that awareness comes in the form of various activities throughout the month, which includes hosting this event with Dr. Washington, who joins us to educate us, inspire us, and support us in order that we're able to continue doing the work of building brighter futures for our children and families every day of the year. And before we get into the presentation, I want to thank several of the organizations that have helped make this possible, this presentation today possible. I want to first thank Sonoma County Family, Youth, and Children's Services and Marin County's Children and Family Services, as well as Sonoma County First Five, Kaiser Permanente, and Sonoma County Paces Connection. And of course, a big thank you to all of you who, with your commitment, are helping us do this work and being here today. So the way today's going to go is we're going to have 2 presentations today from Marin and Sonoma County, and then we'll hear from Dr. Washington. So I'm going to first introduce 2 leaders from Sonoma and Marin County to share some key data points for you to think about as we proceed and sit here today and listen to the presentation. First, we'll hear from Donna Broadband, who has worked in public child welfare for almost 20 years, with 18 of those years being in Sonoma County. Donna has worked as a social worker, a social work supervisor, and for the last 4.5 years as a section manager. Then we'll hear from Bree Marchman, who's the division director at Children and Family Services in Marin County, where she's worked for 17 years in all the different facets of the child welfare system. She is committed to invigorating the prevention conversation in Marin County and working closely with community partners and stakeholders. So with that, I'm going to hand it over to you, Donna.
Great, thank you so much. I am going to now try to share my screen, which we practice, so hopefully should work out well with the PowerPoint. So I will say as I kind of bring this PowerPoint up, and then I will maximize it on the screen. So I want to make sure folks can see that. And then I'll do it. Oh, there you go. Oop. Of course. All right, everybody has it and can see it? Okay, perfect. Thank you. So want to first say thank you for welcoming me this morning and giving me the opportunity to welcome all of you. I'm thrilled to see so many people here. I couldn't agree more, Robin, with your sentiments about child abuse prevention being a community issue. And that is why you are all here today. And so I'm so glad to see you all. I want to also say, I'm going to share just some data points for you to think about through the day and kind of a snapshot picture of what 2021 has looked like in Sonoma County. I want to acknowledge as I share this data that we see clear disproportionality in this data. Specifically, Native American and African American children in Sonoma County are overrepresented in each of these data points that I will share today. And that's something that we are very concerned about and trying to better understand and look at how to address. Those conversations are happening with our community and with our local tribes. And some of you may have been invited to some of those conversations or participated in some of those and welcomed your continued participation in that, because it is data that it's really data, but it's families. We're worried about families and children and what that means for our community. So to share here in Sonoma County, last year we had 4,356 calls that came into our child protection hotline. Of those, 1,776 required some type of in-person investigation by one of our social workers. Thinking about those 1,776 calls, where did they come from? This is a breakdown by cities in our community. You can see Santa Rosa at the top. That's not a surprise. It is our largest city. It's our county seat. There was a mention earlier about Roanoke Park. I think that's a surprise that Roanoke Park is number 2. And Roanoke Park is a smaller city in our community. And so that feels like something we're curious about. Why is that number? Still thinking about those 1,776 calls or referrals, 640 of them rose to the level of abuse. They were allegations that were substantiated by the investigator who investigated them. And this gives you a breakdown about what those types of abuse and neglect were. General neglect at the top, and that is what we would expect to see. That's pretty standard kind of weeks. That is the highest that we see. Thinking about those calls, those 640 substantiated allegations of abuse or neglect, where did they come from? This is a little bit of information about reporting parties. You can see that almost half of them came from law enforcement. You also see what I think is a little bit interesting is a much lesser number that came from schools. And I think that's a question we've had through the pandemic about distance learning, the impact on reporting to our hotline. And so we've seen law enforcement rise to the top of this list, and that's a little bit different than we have seen in the past. Thinking about kind of foster care and adoption more broadly, there in 2021 were 220 children that were brought into foster care because they were not safe at home. In 2021, there were 639 individual children, youth, and non-minor dependents, so 0 to 21, that were in some kind of foster care setting or transitional home or group home during the course of that year. Of those, about 103, or not about, exactly 103 individual children were cared for at our emergency shelter, Valley of the Moon Children's Home. 95 children in 2021 returned to their families. They reunified, which is wonderful, after spending about an average of a year in foster care. And 26 children achieved permanency with adoption with a forever family, which is a great outcome. So thank you. I think it's going to be a great day for you guys. Thank you all for being here.
All right, thank you so much, Donna. It's so helpful to see what's going on in Sonoma County, and then it also gives a little context to what I'll be sharing with you all about what's going on in Marin County. So helpful to get a little bit of a lay of the land as to what we are working with in terms of our foster youth population in Marin. So a little bit of information about what went on in 2021 for us. We have spent a lot of time focusing on prevention and kind of recovering from pandemic when our number of calls to our hotline went down pretty significantly. And we're finally getting back up to the number of calls that we had before the pandemic. So that's helpful because now we know we're really hearing about the kids that we need to be hearing about. So a little bit of information in terms of the numbers. We had 33 children and youth come into foster care in 2021. But we did have a total of 147 youth in care at some point in time in 2021. And of those 147, 17 either reunified or went on to permanency of adoption. So our numbers are quite a bit smaller than Sonoma, but you do see proportionally some similar things going on for us. In terms of the number of calls that we got to our hotline, pretty significant number at 1,000. Again, that number has gone up a lot since 2020. So that was really good for us to see. And of those roughly 1,000 calls to our hotline, 365 required investigation. So that was gives you a sense of kind of the workload of referrals, and we're going out and looking into the community to see, you know, what's going on with our youth. Of those 365 investigations that we conducted, 85 were confirmed as being substantiated abusive or neglectful situations. So we actually don't substantiate a huge number. When you start with 1,000, you only get down to 85. It's actually pretty small, but that just shows we're thoroughly investigating what's going on and seeing what's happening with our youth. You know, Donna alluded to this earlier, the concept of disproportionality in foster care. And I just wanted to share a little data from Marin County because we have spent quite a bit of time looking at our numbers and what it means. You know, we already know, we see the number of youth in foster care does not reflect proportionately the racial breakdown in our community. But I wanted to share specifically some information about referrals because it's important for us to think about. I know there's a lot of mandated reporters in the room. You know, who are we hearing about at our hotline level? Who are we getting calls about? Which families are we getting calls about? And we already know that a lot of the risk factors for child abuse and neglect, such as housing instability, substance abuse issues, et cetera, impact our families of color disproportionately. And so we are more likely to get reports of abuse or neglect on families of color. So I think it really is important when you know this is resulting in more children of color coming into our system, we have to think about how both institutional racism and individual bias are impacting which families come to the attention of our services and our systems. So just looking at these demographics, it's pretty striking, you know, and I know it's not something that we are happy about, and we're actively trying to work on why is these numbers so vastly different. And most particularly, if you look at the number of Latinx children and families in the Marin community is only 26%, but it's a full 34% of the referrals that we get. And then even more striking, only 2% of the Marin population is African-American, and a full 12% of our referrals are about African-American families. So these numbers are concerning, and they should be, because it just lets us know there's a lot of work that we need to do, both within our system and with our community, to kind of raise awareness of this issue so that we can be thinking very critically about why we might be calling on one family versus another. So just want to end by saying our Child Abuse Prevention Council is really working coordinated across all of our community service providers and stakeholders to really work on how we can encourage and help develop using the 5 protective factors so that we can make our communities more resilient and hopefully reduce the incidence of child abuse and neglect in our community. Thank you so much. Robin, you're muted, my friend.
Okay, let me start. That was my rehearsal. So I think this is a great segue into Dr. Washington's presentation on deconstructing unconscious bias and unintended racism when working with children and families. And Dr. Washington is renowned for engaging diverse audiences on the complex intersections of race, historical trauma, social inequality and justice, and the impact of these factors on health and societal outcomes. Dr. Washington is an award-winning educator. She creates and instructs courses and trainings reflecting the deliberate use of educational settings as safe spaces for healing from social and cultural trauma and other forms of oppression that limit the capacity of the human spirit so that learners may use that power to heal the world. Sharon is also a Gates Millennium Scholar. That's so awesome. Class of 2003 and former president of the Gates Millennium Scholars Alumni Association and a network of over 20,000 diverse millennial scholars and professionals. She received her Bachelor of Arts in African American Studies from Temple University and her Master's of Public Health from Columbia University Mailman School of Public Health. She earned her Doctorate of Education at Teachers College of Columbia University, where her research explored medical students' self-rating of preparedness to engage in effective cross-cultural care. And with that, I'm going to hand it over to Dr. Washington.
Thank you so much. Thank you everyone for joining and for allowing me to guide you in this dialogue. I'm going to jump right into these slides to move us forward. As per my personal usual, I have a lot to talk about and not as much time as I would prefer to be able to hold to do so. So with the time that we have together, I'd like to define some important concepts that are alluded to in the title: unconscious bias, stereotypes, unintentional racism, and how it shows up in the intersecting fields and disciplines that show up to support children and families in our communities. We'll explore how these issues show up in the practice of care and services provided in our communities, and really leverage some input that many of you on this call offered in a survey prior to this discussion. And then offer some opportunities for ways to show up in allyship and accomplishment to address these multidimensional challenges that we face. Just to get us started, before we had the session a couple of hours ago, I believe Anne sent out this handout that I encourage you to download. It's a Word document just for folks who, learn in a variety of ways, both visually and, through engagement. It's something that can help to not only keep you present in our conversation for the next hour and change, but also provoke some reflection in real time. So I'm going to move us through some content, but along the way, please do feel free to chime in the chat. If you hear terms or have questions, do feel free to post them there or flag those, and then I'll check in periodically and we'll be able to hopefully stay on the same page. So anytime I'm opening up conversations around our inheritance of structural forms of oppression and inequity, inviting people to bring themselves as their whole selves who are socialized into these hierarchical systems and our shared history, and really reflect on our own identities, reflect on the identities and experiences of community members, and really look at ways in which we show up and contribute not only to harms of others, but also opportunities for allyship, change, and promoting equity. I like to ground these conversations in some shared agreements that can really help to provoke an openness, a willingness to trust in the effort of coming together for these important and constructive conversations to promote a healthier opportunity for all of us. And in particular, through the lens of what brings us together today, really centering the needs of children and families that are structurally primed for having to navigate abusive, toxic systems, let alone inheritance of patterns of harm. So for the sake of our conversation, I want to first center and invite into this dialogue that each of us show up in this conversation with love, compassion, and respect. First and foremost for yourself, for who you are as a person, for what you do, what brought you to this call and to the work that you do each day. And then for each other. And as we are having a very large mixed group conversation, folks have expressed their experiences in a survey, and I'm going to share that. I've pulled some public facing data from your communities that reflect experiences of youth. And so to be confronted with voices that are pertinent to your local experience, that can feel confronting. To talk about these things, to practice articulating from the vulnerability of these identities can be discomforting. So let's hold each other in love, compassion, and respect. Let's be sure to extend that to those communities that are most marginalized, the children and their families that bring us to this space, and then extend the love, compassion, and respect to those who are most invested in the status quo and the systems that we've inherited, so that as we seek to not only change our own behaviors and how we show up in our work, but also the institutions that perpetuate harms, that we're meeting everyone involved with our highest level of humanity and love, compassion, and respect. I want to also emphasize that as people share, not only from the survey and how that feedback lands for you all, but any other experiences that are offered as insight that could help us all to learn and grow and increase our contribution towards equity, that we let people's personal offerings and stories stay here in ways that could be identifiable. But anything that you learn as a lesson that you could then take into your work, into your practice, into your life, let those leave with you in ways that are not identifiable to anyone in this space. I want to also amplify letting this be a non-judgmental zone. We don't have a lot of time together, and so let's not try to seek conclusions about the offerings and the insights that are shared, but instead really try to learn more and better understand where people are coming from with what they offer, rather than making conclusions. And with that, let us have an open-minded conversation, an opportunity for reflection, collaboration, and ultimately a pathway for change. I want to just be transparent that in this conversation, I am going to invite you to sort of oscillate between lenses and how you sort of engage with what I present, internalize and digest what I present, and then make of it some kind of meaning and opportunity for growth. So many of you probably lead in your work and in your day-to-day practice with a lens that really centers youth and their families, perhaps, and the factors that are affecting youth in various ways: their families, their community dynamics, their neighborhoods, their developmental processes, how they're interacting with the media, the traumas that they encounter and that they carry, and what you can do from your role to address those things. Right? That's very commonplace for your professions and called for, right? So many of you are entering into this conversation primed with that lens. I embrace that. That makes sense. I'm also going to invite you to actively engage with this conversation from the lens of your own personal self, who you are. Right? Some of you have your name attached to the box that I can see you through, and some of you have an organization's name, attached to your box. But you as individual people who are the vessels of the care that you have for the community or the passion that you have for the work that you do, you are also people who have been socialized in our society through the media, through formal and informal education, through navigating these institutions as well. And our other, broader societal governing systems that are wrought with inequities and bias. And so as you all are agents of, and participants in dialogue, exchange, interpersonal dynamics, the perpetuation of policies, practices, and norms, and some of you are also leaders with higher level agency to cultivate institutional change. I also want to actively invite you to consciously participate in this dialogue, this reflection, this information from your own personal lens and how you show up and how that matters, right? And so I want to invite folks to really internalize the conversation. Be cautious not to hyper personalize in ways that then make it difficult to be constructive and to stay present, but knowingly and intentionally really holding both of those lenses as we move forward. With that, I want to give thanks to the 97 folks who participated in the survey that was sent out prior to this session that provided just some framework, some context, and some concrete examples of how some of these issues show up in your shared dynamics. Unfortunately, my way of putting these charts together was a little bit compacted, and with the time that I had, I got what I got. So I just want to quickly move through a little bit of introduction and invite folks to full screen to maximize seeing some of this text, but I'm going to highlight the highlights. So just some of the personal descriptors of the folks who did participate in sort of representing this conversation and contributors to this dialogue today. There's, higher level representation. We've got 66% identify as female, 54% identify as white. We've got 38% Latinx, Latina, Latino, 10% Black African American representation. I think an underreporting of cisgender folks, which maybe is a reflection of ongoing normalization of recognizing that identity. 12% LGBTQIA and other sexual minority folks, 10% multiracial, and 6% religious minorities. Just sort of sitting with, I want to invite you all to look for where you are reflected, given, the types of agency that you sit within and represent, how are agencies that you are a part of represented in this sample of voices, and also see where there's a higher prevalence, child welfare organizations and agencies, community organizations, early childhood organizations, county level, etc. And I want to just highlight, we've got 18% senior leader and executive leaders represented in this sample, mid-level administrators, 22%. So I do want to honor that as I invited folks to bring their individual selves, that those folks who have leadership roles not only hold the additional opportunity to be accountable for the institutional implications of this information, but also be personally aware of how that might prime you for fragility, for defensiveness, for not only feeling personally a part of the conversation, but as a representative of organizations that you might sort of see reflected in the feedback. I just want to prime that. But as has been said historically, to much whom is given, much is expected. And so I want to just sort of name that potential discomfort and invite that awareness. Frontline staff are 31% of this sample. Providers, medical clinical providers are represented and will be seen in some of the opportunities for growth in what I have to offer. So with that, I'm going to sort of guide us through some of a what of these concepts and deconstructing what these concepts are and what they mean and how they show up. Pivot into a so what is the implication and the meaning of the impact of these issues, and hopefully guide us through some now what can we do about it. So to begin, I want to just check in, and if folks care to chime in the chat, what is a word or two that reflects how you feel when you see the word bias? When you see it, when you think about bias, what do you feel about it? Is that association with the term negative? Is it positive? Does it provoke something in particular that you can name? But I'd like to just start with a moment to kind of see what comes to mind for folks. And I will be transparent that I identify as an elder millennial, so I can't chat and multitask. So I'm gonna just look at the chat and sort of check us in real quick. I see curious, limitation, prejudice, one-sided, neutral, judgments, awareness, more negative, to be in favor of, so bias can be positive. Neutral, stereotypes, something negative or unfair, kind of defensive, judgmental, assumptions, exclusion. So I think some patterns around a leaning towards judgmental, maybe negative orientation, being connected to assumptions, room for growth, negative stereotypes, lots of negative and unfair. All right. Well, thank you for sharing that check-in. Well, for the sake of our conversation moving forward, I want to frame bias as a function of how our brains operate that produces decisions that we make very quickly. It has to do with rapid associations that our minds utilize to navigate in sort of rapid succession types of opportunities. And it's really driven by the oldest parts of our brain that function through associations and automatic responses. And so research that was done by neuroscientists prior to TikTok, Snapchat, Instagram, and all of these sort of like highly data-driven resources that are right in our pocket. Prior to all that, studies found that 11 million pieces of information are available to us at a given time, and that our brains utilize different sort of mechanisms that filter through all of this information. First, through what we can perceive. So there's types of light, types of sound, types of information around us that our bodies don't perceive, don't pick up, don't interpret. Then, based on what we are able to interpret, we then sort of filter through those interpretations and preferences to create a type of selective attention that ultimately leads to only about 40 to 50 pieces of information actually being absorbed at a given time out of 11 million. And so we can begin to think about unconscious bias as a function of the brain that helps us to constructively navigate a lot of data, a lot of information that could be overwhelming, that inherently creates blind spots to a lot of the shared reality that we navigate. In another more recent study, assessing radiologists and asking radiologists to look at this scan of human lungs for cancer nodes. Not sure if there's any radiologists on the call, but radiologists were asked to look for cancer in this scan. And I'm curious if any radiologists or not are able to see anything in this scan that doesn't belong there. Post what you see in the chat if you notice anything that doesn't belong there. Okay, right. A gorilla. You're de facto radiologists all of a sudden. But surprisingly, 83% of the radiologists who were in the study didn't notice that there was a gorilla here. So what does that mean? Can we not trust the radiologists of the world? Absolutely not. That's not what that means. What that reflects is that when people are engaged in focused effort, it's easy to miss other active salient content that is going on around them. Whether that's when people are experts being charged with doing their expert task, they can miss salient occurrences around them, or when people are doing lay tasks, but are looking for something specific, it can be easy to miss very salient and obvious factors in the environment. So when you all are doing the thing of being a first responder to cases of abuse that are called in, or you are trying to connect people to services, or whatever those charged things are that you are skilled and responsible for doing, it can be easy to miss other salient occurrences that are happening around us, and particularly when they are manifestations of our socialization that we have been socialized or even taught to not talk about. It's unprofessional to bring up in the workplace. Or for various reasons, maybe our own identities and how we experience them are ill-equipped. Lack the racial literacy or the, vernacular to name the occurrences that are happening that we're observing or that we're sensing. And so our unconscious biases that are quite universal as functions of how the brain filters information, biases that we have in what is salient to us and what we track and what we don't, especially when coupled with racial stereotypes that we are socialized into through our media, through our formal curriculum in the history books and who's omitted from those history books, from who we are taught and who we are not taught, as well as how we navigate institutions that perpetuate messages and signals about the hierarchies of how groups of human beings have been valued and devalued. The ways that we also step into policies and practices and norms in workplaces that are wrought with institutional bias that we may or may not be conscious of, and yet it's our job to move those documents forward or to perpetuate those policies and practices. We can perpetuate cycles of unintended racism even when that doesn't align with our personal values or our personal thoughts or what we carry in our heart. And so I want to touch on racialized stereotypes and just create a clarity of terms and definitions. First, I don't think I clicked the important button of optimizing for sound and whatnot. So I'm going to try to share again, just to be sure you can hear it. I did click that button, but now I'm glad to wait. You see my elder millennial coming through? Give me just a second. No disrespect to other elder millennials that are tech savvy. I'll just speak for myself. Okay, here we go. Boom. All right, I think I'm ready. So just to offer some perspective on stereotypes, this is a clip from a replication of the Clark doll study, which was initially done in the mid-50s that researchers, African-American researchers, leveraged the study to demonstrate the implications of segregation towards the Black community and how it was affecting children, and it really led to the desegregation of schools.
Which doll is the black doll? And which one is the white doll?
That one.
Which doll is the pretty doll? Which doll is the nice doll? Which doll is the bad doll? Which doll is the nice doll? And which doll is the bad doll? And why is that doll pretty?
Because she's white and he has 2 eyes.
Which doll is the ugly doll? Why is that doll ugly?
Because he's black.
Which doll looks most like you?
Like me.
Yeah, which one looks like you?
And that one,
Okay.
that doll.
I want to just take a couple of seconds to sit with the video. Sometimes people, in having a strong sort of emotional reaction to seeing Black children internalizing negative ideas about themselves and having that displayed, people can get mad at me. I didn't create the study, and in fact, it's been powerfully used, like I said, to help contribute to the desegregation of schools. And in the painfulness of seeing that, I think it's important to remind ourselves that, you know, no Black parents are sitting down and telling children that's a bad doll or this is the ugly doll, or conveying explicitly these messages, but that children are socialized into making and fostering these associations and these connections through, you know, seeing negative depictions oftentimes of darker colored bodies in our media. I think in the last decade and change, 10 to 15 years, we've had advances in representation in media, and still we're still debating whether or not accurate portrayal or depiction of the history of the United States should be taught in schools. We're still actively having books that reflect the complexity of the oppressive nature of American historical events, having books being banned from libraries, etc. So, and we are all socialized into these dynamics. And as much as these children reflect how marginalized communities inherit those messages and how that influences the psychological development of those children and children like them. It affects the psychological development of all of us that are exposed to those same dynamics. And so in thinking about how we are shaped into, we are primed to have blind spots, to have domains of our awareness that are neglectful of certain elements of our shared reality just by the virtue of how our brains operate, let alone by how we are limited in exposure to diverse experiences because of our segregated neighborhoods, the lack of diversity in the institutions that we oftentimes occupy. And how that's largely normalized in our lived experience, that when we are living void of Black or brown bodies in white neighborhoods or in inner city communities, and we aren't seeing, white folks, that oftentimes is the norm, and not something that's called into question. And so when we think then about how we internalize racialized stereotypes and how that then shows up in our behaviors, as well as in how we interact with policies, practices, and norms around us that perpetuate racial group inequities, I want to be able to be on the same page about how that then perpetuates racism. Racism being defined as not just interpersonal, dynamics that use racialized slurs or that reflect hatred towards groups, or fear of groups. That would be a reflection of interpersonal racism that is, common in, I think, our minds when we think about what racism looks like, mean things that people say or do to each other because they hate one another. And I want to expand that awareness of racism and that understanding of racism to reflect structural racism. And so those public policies, those institutional practices that happen sort of across institutions and permeate industries and, entire fields. Cultural representations, again, in our mass media, in our mass discourse, in our formal education systems, and other norms that work to reinforce and perpetuate racial group inequities. We have inherited inequities that were named even just at the beginning of this call in your local areas. And so the ways in which your current policies and practices and norms perpetuate them rather than eliminating them is the perpetuation of racism. How specific institutions, your specific agency, the county group that's doing this or that, unique and specific organizations, agencies, departments, and how their policies, practices, and norms on an institutional level perpetuate racial group inequity is institutionalized racism. And then speaking to that video from the Clark Doll study, the ways in which marginalized groups internalize the inequities that we've inherited, the norms and standards that look to people of marginalized identities as less than, as devalued, as more criminal, as more suspect, with other negative assumptions and associations, internalizing that of oneself, of one's community, of others who are like-minded or like identified is internalized racism. And oftentimes in collective discourse in the workplace, when we're trying to grapple with these issues, we might find ourselves having to just defend that structural racism is a real thing, that we don't even get to offer the support, let alone resources and opportunities for healing for those marginalized team members who are carrying internalized racism in how they navigate the workplace and the dynamics and the harms that are at play within the institution. So I just want to offer the framing of those 4 levels and the ways in which, especially as we think about internalized racism, not only is that something to reflect on for how it affects your youth, how it affects the dynamics of the families and their communities, but also your staff of racially marginalized identities, and how many of your staff come from the very intersecting dynamics of disadvantage, let alone social marginalization that these patients or clients or youth do. And are also navigating the workplace dynamics and how that might perpetuate those institutionalized racism might perpetuate harms in the workplace as well. Interpersonal racism shows up again in the experiences of youth and their families and the communities that they live in, and how they access services within the institutions of your agencies and organizations, as well as how Black, Indigenous, and people of color who are staff, who are leaders, are navigating the workplace and their lives. Looking at institutionalized racism, that your policies, practices, norms in your organization, how you hire, how you recruit, pay inequities by gender, by race, by the intersection of race and gender, is something that you aren't going to be able to effectively promote equity with your youth and their families while you perpetuate inequity internally in your policies, practices, and norms as an organization. And then the ways in which local, county, state, historical context, policies and practices, traditions and norms have perpetuated and continue to perpetuate inequities through policies is something that each institution can be collaborating to advocate and to deconstruct and to dismantle upwardly, in addition to working on how those issues show up within your institutions. At some point, we've got to be working collectively to change the structures that govern our various institutions. And so I think it's important to keep in mind that as we think about these identity categories and sort of how individuals show up as youth and their families, it was named before, we're not just talking about data, but real people. And people manifest the social implications of creating these groupings. And so historically, ancestors of ours created these, groupings that then demarcated hierarchical value, such that people who own land had more societal value. People who were determined to be white had more societal value and freedom and liberty, etc., had more access to power by being able to create laws, being able to know how to read, being able to vote, being able to have a bank account, being able to own land, right? To be able to sit on a jury, to be a peer, to be counted as a full citizen in the US Census. All of that reflection of power is what's at the core of this wheel. And so the people who created these identity categories that we've inherited that reflected themselves, the founding fathers were largely able-bodied, white, land-owning, neurotypical, US citizens. And so the ways in which the systems that we've inherited have concentrated power towards the most privileged identity groupings and categories of people, categories of citizens, while actively marginalizing, actively targeting, actively building the capitalist profits that our economic system has been based on from the suffering of the people in the margins, from the killing of indigenous people, from the enslavement of people of African descent, placing moral devaluing of people who are then marginalized, who are exiled from systems and access to opportunity, access to full humanity and representation and, full humanity in the census, for example. This gives us an opportunity to see not only where do we identify, where do we see the boxes that we've checked on intake forms represented in this power or in this wheel, and what is our proximity to power given our various identities. It also allows us to appreciate that we might navigate different identities and their privileges and disadvantages differently in different contexts. I also want to highlight that the intersectionality as offered by Kimberly Crenshaw is really reflecting not just how individuals sort of navigate these identities, but really how the identities themselves are a reflection of structural hierarchical systems of oppression. That it's not as though we just sort of organically evolved human language and we were like, people with master's degrees should be paid more than people with a high school diploma. People generated these ideas and reinforced access to opportunity and power within our systems and our institutions based on privileging largely themselves. And so to sort of depersonalize the idea of intersecting identities from just sort of how individual people operate in their identities, but really calling into question the ways in which these identities were structured to promote hierarchies that benefit some and disadvantage many. These identities are reflections of systems that were created in hierarchical form to oppress many and benefit some few, right? And we've inherited that. You all have inherited just a couple of samples of some of the historical context that drives the structural racism embedded in some of the fields that are servicing children and families. On this slide, particularly social work, criminal justice, fields within the criminal justice system. We've all inherited the structural, systemic racism that is embedded in how these industries, how these fields, how these practices were birthed in the United States, while enslavement, while Jim Crow was fully, a part of our national identity. Such that segregated settlement houses is part of the formation of social work, segregating the services as services were allocated towards vulnerable populations, social workers as suffrages actively blocking African Americans from being able to vote while trying to amplify the opportunity to vote for white women. People in social work supporting eugenics and the active marginalization and targeting of disadvantaged groups, mentally, ill, people experiencing homelessness, Black people, Indigenous people, and targeting them for reproductive oppression and sterilization. Helping to recruit into things like the Tuskegee syphilis experiment that has ongoing implications for trusting relationships between the Black community and social services and medicine. And so just to sort of ground us in that we have inherited the legacy of the institutions and the industries that we care about for the good that they bring to our communities, while also needing to account for the active harms that are wrought within the legacy of these fields. That the emergence of a justice system that engages with youth has been birthed in a system of racism, such that immediately post-emancipation from slavery, laws and policies were passed that then made it possible for former slave owners to essentially take back Black children and be guardians of them, and rather than calling them slaves, calling them apprentices, or forced free labor through convict leasing, such that in states like Mississippi, most convicts that began to be targeted as Black bodies post-emancipation were only living in incarceration for about 7 years because it was such a violent system towards Black bodies. And so one, just sort of like embracing the ways in which in the practice of your work, you've inherited the legacy of the structural implications of how our fields have formed through oppressive practices towards entire groups and communities. And just because we in our individual care and our recent policies and statements, especially post 2020, are working towards being in more alignment with equity, doesn't inherently resolve the historical trauma that communities and individuals of marginalized identities experience or perceive when they seek to or are brought to navigate your systems, your agencies, and the services that you have to offer. So in thinking about some of the so what, some of the statistics building on what was presented from a local perspective, just looking nationally at disparities that show up in child and family services, that at nearly every major decision-making point along the child welfare continuum, there are racial group inequities, despite similarities in child development and experiences of abuse across racial groups. And so despite commonalities and similarities in behaviors and development, we see that rates of child abuse and neglect, while not being higher behaviorally in families of color, are disproportionately petitioned and brought into the court system and face greater likelihood of removal of their children than white families with similar behaviors. On the national level, African American families are overrepresented in reports of suspected maltreatment, as well as are subjected to Child Protective Services investigations at higher rates than other families. And African American and American Indian or Alaska Native children are at greater risk than others of being confirmed for maltreatment and placed in out-of-home care. Similarly, once involved with child and family services relative to other children, Black children spend more time in foster care, are less likely to reunify with their families, and are less likely to receive services. Building off of a legacy of these institutions depriving these very children, these very communities, and these very families from services, the gap is clear. The gap was built into the approach to delivering social services to communities. That exclusion was built into the formation of how services are delivered. Black and Indigenous children are more likely than other children to be removed from their homes and experience termination of parental rights. And in looking more specifically at drug-positive newborns, found that African American mothers were more likely than white mothers to be reported to CPS, despite the similarity of overall health characteristics of their infants, and that children from diverse racial and ethnic backgrounds with head injuries were almost twice as likely to be reported for abusive head trauma. Now, not only is that calling into question why the higher reporting among Black and brown children, and then what are the implications given the disparate lack of access to resources once those children are involved in the systems of care and the continuum, but also what's happening to those underreported white children. So that's part of what gets lost when we talk about disparities, and we focus, rightfully so, on those communities that bear the burden of the harms and the legacy of oppression that goes largely unchanged, or actually in different dynamics gets worse over time. But also when we talk then about white privilege or the privileges of communities with dominant identities, it gets lost and omitted the abuse, the harms, and the suffering that is perpetuated generation after generation within white communities, within white families, within communities of dominant identities, when we fail to explore when those behaviors are showing up because of whatever is wrapped up in why those go underreported. A study that looked at the implication of dehumanizing Black children through associations of Black bodies with apes or other dehumanizing depictions, that when we think about stereotypes throughout our media, throughout the history of media, again, prior to like the last 15 minutes and the rise of Beyonce and Rihanna, that, many of the representation of Black bodies that we saw prior aligned with associations that were dehumanizing. And that in a particular study that looked at the effect of those dehumanized associations among police officers, as well as a broader sort of representation of white female undergraduate students, they found that among the police officers, who were mostly white males, average 37 years old in urban areas, that when those officers that had been exposed to images that sort of associated Black bodies with apes and other dehumanizing images, that it was associated with more violent encounters with Black children when they were in custody. Those white female students that were sort of assessed for their associations of Black bodies with more dehumanized representations, they were asked to sort of associate their sense of culpability or responsibility or innocence to pictures of children, and students that considered Black children significantly less innocent than other children beginning at age 10, when they had higher associations of Black bodies with dehumanizing images. There was an overestimate of the age of Black children, such that when presented with a Black child, they estimated that child's age to be 4.5 years older than their actual age. So not only are Black children seen as older, but they're also seen as less innocent. And so when we see that among a sort of lay population, we see parallel results among populations of people with whom there is agency, there is control, there are guns and weapons involved with the identities of these protected individuals in our communities as police officers, and that there are associations with the behaviors of those people relative to their association and dehumanization of Black bodies, and specifically Black children. Thinking about Tamir Rice, thinking about Trayvon Martin, thinking about Michael Brown, honoring what we can empirically measure about those associations and some of the science to it. We shouldn't have to rely on science to see that that's problematic, and that's a reflection of broader structural systemic issues, but we can make those connections. Further, looking in the healthcare field, given we've got a number of physicians in this community involved in the system and continuum of care and engagement with children and families, that a lack of empathy for Black bodies contributes to how healthcare providers associate or understand the pain of Black patients. And so in one study in 2012, participants of all races, which were lay folks as well as a sample of medical personnel, assumed that Black people feel less pain than white people. When presented with the same type of bodily harm, but different bodies, there's an assumption of Black people just feeling less pain for the same encounter than what a white body feels. Further, patients' race has been found to be sufficient to cause biases in how physicians allocate pain treatment, building on the idea that people assume Black bodies are more impervious to pain. Those people who can allocate medication and treatment and standards of care to different bodies do so in biased ways that prejudice Black bodies to get pain management slower, so they sit with and experience pain for longer, and they get sub-quality amount of pain distribution than their white counterparts. And when that empathy gap is primed in some kind of intervention, it produces a difference in 55% of cases, such that if you prime a care provider to not be biased towards this Black body, 55% of the time they're going to treat them with the standard of care that we expect all patients to receive, but that Black bodies disproportionately don't get because of racism. And we understand that patients that experience highly empathic care or empathetic care have better outcomes. When the person who is engaging with a patient is caring about and feeling for empathetically what that person is going through, it produces better quality of life, decreased depression, better adherence, and other positive outcomes. And so it matters when people are feeling that they're being met, they're being understood, they're being cared for. And so among those of you who participated in the survey of your experiences, you were asked how many times you have directly or indirectly witnessed a youth or their families being referred to in derogatory or insensitive or offensive ways. That's just based on what you observe. And 40% of you expressed that sometimes or often you have directly or indirectly witnessed those kinds of behaviors. And that's not to even account for those systemic and external experiences beyond your observation. When asked about the identity factors that were targets of the microaggressions that you observed directed towards youth and families, these are those that you reported. So 40% race, ethnicity, skin color, socioeconomic status. I want to honor that let's see, while some of you have not witnessed, 33% of folks said that they hadn't witnessed any of these kinds of microaggressions. One, I would invite you to not assume that that means they're not happening, right? If you are white, if you are a person with a leadership role, if you have intersecting privileged identities, there might be reasons, those might be almost protective factors why you, or buffering factors why you wouldn't see those things, why people wouldn't make those comments in your presence. So one, that's an invitation to not assume that they're not happening. But also I do want to just, offer that is the case, that may be either a reflection of blind spots or what is omitted from your presence, as well as the possibility that you could be in a workplace that's practicing higher levels of inclusive practices that mitigate these kinds of behaviors. And when asked about who have been the sources of those kinds of offensive remarks and behaviors, I want to just highlight what you all reported. Amplifying that 11% of the sources of those offensive remarks were senior leaders, executive leaders, 12% were mid-level administrators. That's really important given the higher level responsibility leadership has to drive and direct equity, let alone embody it. With frontline staff, being front-facing, direct contact to the most vulnerable in our communities, we want to really pay attention to that. The family members, the guardians, and the caregivers that are oftentimes marginalized themselves. What are your policies, practices, and norms within your institutions to supportively and in a trauma-informed way mitigate the harms that people may be perpetuating horizontally to perpetuate racial group and inequities and horizontal oppression across groups? So I looked at some publicly facing reports from throughout Sonoma County, Santa Rosa, some of your local areas, just speaking to some of these issues and how locally it's been reported. So I'm grateful to see some of the stats that were offered earlier, but youth themselves in Sonoma County high schools offered that when asked about witnessing or hearing of cases of verbal discrimination against racial minorities, that 59.8% of the youth in your local area have agreed that they've had those experiences. 30.4% agreed or strongly agreed that they've witnessed or heard of physical discrimination against racial minorities. I pulled from a public-facing report from the Department of Probation in Sonoma County and their assessment of youth experiences in some of their facilities, and the notion of assessing empathy in the delivery of care and services were of some of the lowest reported elements of the motivational interviewing approach and best practice that's being attempted. That feeling that my PO or staff really seems to understand how I think or feel, quite fairly low in young people experiencing that empathy. Through the leading through listening, student and community voices, centering young people's voices, especially in the context of COVID, young people increasingly as they age into adolescence and young adulthood, feeling less and less like they are a part of their community, having experiences of health issues, and depression, anxiety, feeling stressed among our young people, and particularly with the intersecting identities of being LGBTQ. This particular survey did not assess this same factor among racially marginalized youth, which could be a recommendation moving forward, but just recognizing that these issues are being embodied by the young people locally when they are able to express that those are their experiences. Further, some social justice organizations in the local area created a series of report cards on race. looking at local and county level leadership groups and demonstrating that largely there is a failure to address the needs of representing racial equity within the communities and the marginalized groups that live there. Now there's the sort of how this is affecting youth, families, and your communities. And then there's also the ways in which those, especially Black, Indigenous, and folks of color within your agencies, not only are members of the community and vulnerable to how marginalized groups interface with institutions on a community level, but they also are your staff and wanting to be promoted or wanting to be leaders themselves or wanting to be protected from discrimination. And so having, you all, members of this call, members of your staffing, express how you have felt marginalized or voiceless. 24% said sometimes or often. When asked how frequently you have felt targeted, not just marginalized or voiceless, but targeted or attacked due to some aspect of your own identity, 11% said sometimes or often. And some of the specific expressions of how that has showed up reflect the themes of being minimized or devalued, racial and cultural stereotypes being represented, incarceration and substance use, stigma and stereotypes, socioeconomic biases and harms, and LGBT facing biases, stereotypes, and stigma. And so as I let you look over some of these quotes, I want to just highlight that not only are these quotes and the expression of these kinds of harms a reflection of experiences people are witnessing among your youth and their families, but also they themselves. And so things like I hear those people a lot, the unhoused are dehumanized and treated like a garbage problem. I was personally, Sharon Washington, taken aback by the expression of sexual harassment against staff and employees, physical intimidation, opinions being ignored, uncomfortable touch, the expectation of volunteering without pay. That was from staff people. That was from employees. That was from people speaking on their own experience, not even that of the youth and family, as though that would, but folks who are on the clock are having these experiences. And so again, just to sort of challenge, especially among leaders, to not only lean into the importance to embrace equity, to impact your youth that you serve and their families, but also the staff who serve those youth who also come from oftentimes similar backgrounds and are navigating those dynamics in the workplace themselves. Comments around that part of town, over-reporting suspected child abuse by mandated reporters based on race and poverty, which has been highlighted already in some of the statistics that were shared earlier. One staff person or participant in the survey offered being in a same-sex male couple and being told that I essentially have a wife. Again, while at work, right? And oftentimes HR policies around things like harassment or discrimination don't speak to microaggressions, which might be subtle slights that only happen once, when harassment might be defined as a single person doing the same thing over and over again. Well, what if the same one Black woman gets her hair touched by this staff over here, that, person from a different agency over there, this person in the hallway? We don't even always know who these people are that are groping our hair, but it's our body, it's our liberty, it's our personal body parts that are being violated, and there's no real policy built in place, oftentimes institutionally, to protect from those things. I have shared a lot. We don't have a whole lot of time, but I do want to check in quickly and see what's in the chat. How are you in your mind, in your body, reacting to what I've shared so far? What's been challenging to receive and sit with? What might be affirming? But I want to just take a moment to quickly check in and see how you're holding all that I've shared thus far. So I'm checking out the chat. I see it's shocking for some just how deep the trauma goes. So much to be untangled for healing to happen. Thank you, Shayna. Someone asked, how do I define African American? I personally, as a person who identifies as Black, of African descent, African American, I interweave between those terms, although I recognize the distinctions in them. When I said African American, I meant, largely speaking, people of African descent in the United States. That can include people who identify as continental Africans who are citizens or non-citizens but are here, people of the diaspora, but also American-born descendants of slaves, American-born descendants of the African continent in some diasporic way. So I mean it loosely and inclusively, although I honor the multiple nuances within subgroups who are bundled into that category. Thanks for that question. I see lots of folks are sadly able to relate, recognize there's a lot to be done, seeing that things are eye-opening. So thank you for sharing in the chat. I'm gonna just move us forward into some of the now what, and then we can have discussion with the time that's left, friends. So one element of what I want to frame for folks is increasing our own individual anti-racist lens, operating through which, from an approach through which we accept that we have been socialized and are operating in systems and institutions that were birthed with racism in their DNA. That historically, that is accurate to our context, and that is individuals who are socialized with mass media, with textbooks, with formal and informal curricula. Anti-racism is inviting us to embrace that we are socialized into mechanisms that perpetuate racial group inequity. And by embracing that, we then challenge ourselves to account for the ways in which we can interrupt that. So rather than taking a passive stance of, I'm not racist because I care about everybody, I treat everybody the same, I love all human beings, I don't see color, which can allow us to miss the opportunity to learn more about and to honor the unique experiences and dynamics that people have because of their racial experiences and their color. But it also relinquishes our agency to interrupt systems of oppression where we have the power to do so. And so anti-racism invites us to embrace that we're socialized into racism and take account for the ways in which we have the agency to interrupt racism through how we show up as peers, how we teach ourselves, how we shift our behaviors to interrupt and disrupt and dismantle the racial group inequities that we're primed to perpetuate. And so looking at this sort of image of not intended to be a linear process, one that is dynamic, that, as folks talk about or reflect on race and racism, we might find that our behavior shows up in one of these levels. Like we might be antagonistic, where we're very unwilling to have the conversation. Most of you probably wouldn't be here unless somebody of a higher role in your organization told you to. But oftentimes, we might encounter people who deny that racism is real, deny that microaggressions are relevant, defend the status quo, that if you really want to contribute, you need to pick yourselves up by your bootstraps, and structural racism isn't a factor. We might have folks who show up as avoiders, who, out of wanting to keep the peace or wanting to stay comfortable or wanting to progress in their career and not ruffle any feathers, avoid racial discourse, avoid confronting inequities, avoid change when it's introduced to the organization, or might agree with the dominant group publicly, even though they don't personally value that. Maybe they personally have a spouse of color, right? But in the workplace, they agree with the policies, practices, and norms that are hurting their peers of color, in avoidance of equity dialogues and the discomfort that come with them. We might have folks that show up as actors that offer, public facing sympathy, but or private sympathy, but public facing sort of like silence, or might make performative moves and immediately look for a pat on the back, or might even get defensive if they don't get a pat on the back from folks of color. And then we have allies that really embrace the opportunity to learn, to change, and to help to center the voices that have been marginalized historically and ensure that they're provided access to opportunity to grow, to thrive, and to be included. Building on that desire for inclusion would be accompliceship, where folks with dominant identities, with privileged, intersecting identities and positions in the organization would not only listen to people with marginalized voices and with marginalized perspectives, but actually help to amplify those folks so that they too can lead, so that they are no longer marginalized, right? And so that we create different representation at all levels of each of our institutions. And that being an ally or being an accomplice is not something that is a self-determined, asserted title. It's something that is bestowed from people of marginalized groups to people who they see in action consistently offering their support. It's not something that you take breaks from on the holidays when you're with, cousins and uncles that have different perspectives that are blatantly biased or bigoted, and we don't want to ruffle their feathers. Instead, allies are consistent with those values on and off the clock. And, they don't focus solely on marginalized folks and, being an empowering source for people who are different from them, but also really focus on engaging in critical conversations and focus on behavior and institutional change with people who are like identitied, with privilege and with power. And as folks are navigating racial discourse, evoking racial discourse in your organizations, when you are called in or called out or, challenged or reported even for perpetuating harmful behaviors towards folks with marginalized identities, I try to invite folks to practice listening, receiving, and validating. It can be so easy, especially for folks with leadership roles, to be defensive. Sometimes folks with organizational titles can be defensive of the organization even when they personally haven't even been named. And so that defensiveness can really stifle the ability for people with marginalized perspectives to speak up and to speak their experiences, which then can create an opportunity for equity to be institutionalized. So being able to mitigate that reaction and listen to what's being said and not how we feel about it. Track how you feel about it and note that, but listen to what people, especially from the margins, are saying when they're gifting you with their perspective, especially those that are harmful experiences. Receive it, internalize it so that you can grow in empathy, but don't hyper-personalize it so that you become debilitated. And validate what those experiences are. When you can apologize without placing an onus for atonement on that person, and then go and prepare yourself to change those behaviors. I invite folks to focus on, as you grow in your own racial literacy, to navigate this kind of discourse and apply institutional practices, to focus on your own self, your own identities, your own triggers, your own reactions, how these issues show up in your shared spaces, both physically, and sometimes you'll have clinics or hospitals where all of the chiefs of staff have been older white men, and you see all these pictures of older white men. And how does that make folks of color who might want to be a chief of staff one day feel to see that lack of representation? So just thinking about how equity is showing up or not showing up in your shared spaces, in the systems and policies and practices that make your institutions operate. How can you align yourselves in solidarity with those who are most marginalized? And from a place of solidarity, then speak up as allies and accomplices and advocates, and work towards shared, empowering solutions for all of the folks involved. Now, many of you, I know that we're coming up on time. So as we do, if folks have to jump off before I reach my last slide, I thank you for your time. But from what you all offered in the survey, many of you reported when asked about your organization's level of engagement in diversity, equity, and inclusion work, a number of you sort of reflect that not only are there harmful things going on or no efforts towards DEI or happening, or there's a toxic environment perhaps at play for folks of color, or there's some maybe performative engagement with these issues. I want to offer perhaps climate surveys, needs assessments, creating some mechanisms for marginalized folks to be able to express what they're truly experiencing with some safety and protection. Also, cultivating leadership development among your highest leaders to make sure that those with the most decision-making power are racially literate to be able to move forward with a vision of this work that people can trust. If you're a part of organizations that were reflected as having some diversity efforts, but they're superficial and inconsistent, there's an inconsistency between values and practices. You might look at, really institutionalizing some leadership or a diversity committee that can help to stabilize those efforts, creating a strategic plan or embedding these efforts into a strategic plan along with metrics of accountability, having organization-wide training or a curriculum that can hold the group accountable for maintaining these dialogues and a growth in the ability to manifest racial literacy in everyone's work and performance. And if you're a part of these organizations that do have more significant, consistent, championed issues or efforts and initiatives, ensuring that you then have pipelines to promote recruitment and retention of diverse members at all levels of your organization. If you've got efforts and training going on, but at your board and at your executive level, it's all white, you're not there yet. Checking your talent management processes and making sure that, again, inclusion and equity is happening in pay, in hiring, in promotions, and having transparency and reporting around harms and biases that do come up, as well as having that community engagement piece so that not only are you internally promoting equity among your staff and your employees, but that is extended to how you actually engage with the community, your clients, and their families. So that was a lot. I know that some of you may have to go, but I do have some extra minutes in case there are questions, there are comments at this time. For those of you that need to part ways, I want to thank you for your time and your presence in this space. But for those who do have some additional minutes, I'm open to any thoughts, comments, or questions. I see that there are some comments in the chat, and just for the sake of this being recorded, as folks do trickle off, I'll give thanks to you, but I will address some of the comments just so it can be recorded, and as folks receive the recording at a later time, could be able to track any responses to my comments should you have to part at this time. Is that okay for folks? All right. Well, I see from Ariel Graham, what about communication styles in the workplace, like being seen as aggressive because you're passionate, and your cultural communication style, like talking with your hands? I appreciate that. I see that a lot. I personally have experienced that now as a consultant, where I get to very much sort of shape how I engage with folks. I prime people for how to interpret how I communicate. And so I can appreciate that comment. And I think that that's a reflection of why it's really important, as I offer the need to deconstruct these issues as you work with, youth and their families, that how those marginalized members of the community, some folks may have experienced child and family services, and now our staff that passion, that understanding, that appreciation for these services and the gaps that we have, that we've inherited, that perpetuate racial group inequity, when we articulate that with the loudness that we have in our homes, that means I'm invested in this, that I'm excited, that this is something that I live and that I breathe, and that you're feeling the vibration of that breath as I talk about these statistics. And in fact, that's a gift to how I show up. The ways in which that does get docked in people's evaluations, that gets targeted as an indicator of being difficult to work with. It can promote and provoke white fragility, among oftentimes white supervisors and leaders. You even see that client facing when you've got folks who go into houses and homes and family dynamics that are people that are led by culture, led by cultural context and language, historical contexts that are very different from those who are doing the assessing and the reporting. And you might see a harsh tone towards a Black child when a white social worker is there. And that white social worker could dock that tone as aggressive, as, maybe harmful, as concerning, when that tone has been historically associated with protecting Black children from overseeing white gaze that can hurt us. And that protective feature is something that we have inherited and transferred to protect our children from white bodies that have had the agency to harm us, had the agency to take our children away from us. And so there's an actual inability to interpret the complexities of what that tone means as far as our love and our protection for our children, not harm and abuse or violence from us, right? And so where do white social workers get taught that? Not oftentimes in graduate school, right? So I appreciate you amplifying that. What else do we see in the chat? Any moderator want to amplify anything that stood out to you?
Yeah, Shayna had a question that you see that one. Do you have more brief info on the history of eugenics and social work?
Here's what I'll say to that. I'll say the history of eugenics and social work is prevalent and prominent as it was in medicine, as it was in the emergence of policing, and all of the fields that govern our society. Leading thinkers across industries and fields promoted eugenics throughout the times in which our very the fields that intersect most to address children and families and communities of color emerged: psychology, sociology, etc. So I can't unpack that history in ways that I know that there are accessible resources online that can really articulate that well for you.
I think someone had also asked if you could put up the last slide again. Brandy wanted to take a look at the last slide you shared. I think you accidentally muted yourself as well.
No problem. Yeah, is this the last slide that folks were looking for?
I think so. Brandy, is this the one you wanted to see?
Great. What is affirming? Microaggressions. Oh, this is affirming. Okay, microaggressions do happen in the workplace. Great. All right, friends, if there aren't any other thoughts, questions, comments, I want to give thanks to you all for allowing me the space and your extra minutes. And I appreciate all that you all are doing, all that you're contributing, and I really hope that this is insightful and encouraging to really allow for and embrace the opportunity for these kinds of dialogues to happen in your workplace. They're critical, they're needed. You know, staff of marginalized perspectives need the opportunity to process and to share what they're experiencing without having to teach white leaders and people who get paid more than them what this is, right? So I do want to encourage that the need for these dialogues to be actively happening is so important to create a healthy and constructive work environment for you all to do the critical things that you do, and to support those who come from marginalized backgrounds that are really contributing to the work that's being done in your important organizations. And yet those who come from the margins should not have to drive the change. And when they do drive the change, please compensate them accordingly, because it affects us not only, you know, professionally with taking up our time, oftentimes assumed as volunteers, but also we can carry the intergenerational, the personal exposure to these traumas, and it makes it much more complex than an intellectual endeavor to grapple with this work in the workplace. It is oftentimes very personal, very triggering, warranting of counseling and additional support that we oftentimes don't have and is not part of our compensation. So I want to honor and invite you all to really pay attention to that as you embrace these opportunities for dialogue, and then move from dialogue to institutionalized change and sustainable change that then doesn't rely on individual team members of color to make this something that's a priority. Move from it being a priority of values to one of financial investment, to programmatic investment, to pipeline processes to really promote equity and inclusion at all levels of the institution and its efforts. Thank you so much, friends.
Yeah, so much great information. I feel like we need you back every day to remind us of these things. So it's thank you. It was an honor to have you here. Thank you.